Hello, my name is Miriam, and I will be discussing the CDC's article, What CDC is Doing About Mental Health from June 2025. The CDC highlights its work in tracking mental health data, reducing stigma, and expanding access through prevention programs and partnerships across the country. I also use updates from the APA 2025 and Health Affairs study by McGuire and Miranda to discuss equity issues in mental health care access in America. So, for the problem statement, I would like to discuss how the US is facing a growing mental health crisis. 1 in 5 adults experience mental health illness each year, yet fewer than half receive treatment. Those most affected include low-income individuals, racial and ethnic minorities, and rural residents. Key contributors include provider shortages, limited insurance coverage, and stigma, all of which got worse during the pandemic. Recent policies also focus on making care more accessible and equitable. So that dives us into the solution. Telehealth expansion allows virtual visits for therapy and psychiatric emergencies, reducing travel barriers. Insurance reforms allow for the expanding of coverage and cut prior authorization delays. And then we have workforce development, which allows for grants and programs to train and recruit providers in underserved areas. Integration with primary care embeds mental health services into routine care, reducing stigma. And then the evidence of the impact is that telehealth improves access use and patient satisfaction, according to the articles. And then moving on to the equity implementations, mental health inequities do still remain, especially in rural, lower income areas and minority areas. Policies expanding tele mental health and workforce training help close these gaps, but challenges like internet access and affordability also still do persist, unfortunately. The CDC does stress that continued investment in digital inclusion as well as community-based care are vital for equity. So ensuring that the telehealth care is accessible to people with Medi-Cal, Medicare, anything of that sort would also help with this implication. And then my quiz questions